Tell you about this story. The South African Tobacco Transformation Alliance has formally rejected the consultative process on the proposed tobacco bill. The online process was convened as part of the socio-economic impact assessment that's required before the Control of Tobacco and Electronic Delivery Systems bill can be processed. In 2018, Cabinet approved the draft bill with the support of the World Health Organization. Talk about why they is opposed to it. We can speak to SATTA spokesperson Zacharia Motsumi, who's joining us by Zoom, I believe. Good to speak to you, Dada Motsumi. First things first, what is your main point of opposition to this bill?
Thank you very much for having me. As SATTA, what we are saying is that we believe that this is just a tick box exercise that the government would like to do. One of the things that we have experienced is that this bill was drafted in 2018. And with that, the government itself, they said that there were 21,000 comments, but none of those comments were involved in this bill. And we believe that the government decided that those 21,000 comments were non-significant. So this is just, according to us, we believe that this is just a waste of time that the government would like to do. And secondly, what we have noticed is that we have been having this pandemic since 2020, but the government didn't recognize that, and this had a negative impact into this company. You'd recall that we had a 20 weeks ban on the tobacco and cigarette sales, and that had also a serious impact to an extent that the industry at this stage is on ICU. And we are trying to recover, and then this is still going to take us 3 to 4 years to recover. So it is for that reason that we are saying that this bill, we totally reject it as it is.
Let me ask you about these 21,000 comments that you say were made by the public as part of the submissions. When you queried what you say is the comments being left out, what were you told?
This is what we mentioned to our government with our submissions, but they never responded to us by saying that this is the reason why they decided to not to put one of those comments in this bill. So and this has, according to us, more especially the lockdown, has increased the illicit trade. So that is our point of contention.
And the two broader aims of this proposed bill, one would be, of course, to try and limit the health hazard faced by people, in particular children as well, where we're talking about secondhand smoke, where you are in an environment where smokers are around and they're puffing away and you're exposed to the smoke. The second is to better regulate the vaping industry. What do you think should be the interventions that are introduced to deal with those two issues?
What we are saying is that our government should start first dealing with illicit trade. Because if I can just take you back, by 2020, we had there was a ban on the tobacco and cigarettes sales. And then still, during that time, we saw people were still smoking. So what we are saying is that this is not going to bring any reduce the consumption of smoking to our people. So this will just increase the illicit trading. That is why we are calling our government to please ratify the WHO protocol that they signed in 2013 that seeks to eliminate illicit trading, because illicit trading is a problem. It's something that needs to be attended to. That is the biggest problem that we are having. And this is what we have mentioned to our government.
You speak about illicit trade and people getting cigarettes off the black market and such, but this bill would, for example, remove designated smoking areas in restaurants, ban outdoor smoking in public areas, and regulate e-cigarettes as tobacco products. Just to quote from the WHO, which you've just referenced, it said that designated smoking areas had been ineffective in preventing harm from second-hand smoke. It sounds to me like, at the moment, you and government are caught between two arguments. You're making the case for economic effects on the industry as a result of the bill. Government is saying, well, we need to keep South Africans, especially those who don't smoke, safe from second-hand smoke. Where is the balance?
As you have rightly mentioned, that we are holding different positions. What we are saying is that even if we can put in those measures in place, if we cannot deal with illicit trade, this problem will still be there. So that is for that reason that we are saying that the biggest problem that we are having here is illicit trade, because the illicit traders, they are not regulated at all. So the people, what the government wants to do is to regulate the legal tobacco business, and then by doing that, we believe that they'll be handing over now this business to the illicit traders, because they are doing as they wish.
Is it not an unfair argument, sir? And apologies for cutting you off, we're just pressed for time. Is it not an unfair argument to say that because illicit trade exists, there shouldn't be further tightening of restrictions on the tobacco industry, those of you who are operating legitimately, and as I was saying, where we're dealing with issues of a health hazard from tobacco?
We are saying we are not opposed to any tobacco control measures that the government would like to put in place. But what we are saying is that the objective that the Department of Health would like to achieve is to reduce the consumption of smoking. But how do you do that if then the illicit traders are with the NKC research that has been released? It says that the legal tobacco business is outnumbered by the illicit traders. So how do you then regulate that? Because the first thing that you need to do is to fight the illicit market, and then we can start now talking about how do you then put up some other measures to make sure that you control this tobacco and the consumption.
Let's leave it there, sir. That was the spokesperson for the South African Tobacco Transformation Alliance, Zacharia Motsumi, speaking to us this afternoon.